Today, former Facebook product manager turned whistleblower Frances Haugen testified before Congress.
She wants lawmakers to take action against the social media giant. Haugen says Facebook is hiding what it really knows about the spread of misinformation on its platforms, including Instagram, and the hurtful impact its algorithms can have on teenagers, especially young girls.
It's just like cigarettes. Teenagers don't have good self-regulation. They say explicitly, I feel bad when I use Instagram, and yet I can't stop. We need to protect the kids.
Facebook's own internal research provides powerful proof of how damaging its platforms can be to teens and their mental health. News 8's Ariana Cohen talked to a local expert to find out why.
I talked with a local child psychiatrist, and she says one of the biggest things young people do is compare themselves, and this causes negative impacts on mental health. Frances Haugen, the former Facebook employee turned whistleblower, told Congress Tuesday that social media giants Facebook and Instagram are affecting young people's mental health.
The Facebook knows that they are leading young users to anorexia content.
And Haugen says after viewing this content, young girls actually use the app even more.
It can become very addicting. I tend to go onto an app and I find myself scrolling, and then I'm like, why am I doing this?
San Diego child psychiatrist Dr. Willow Jenkins says most young people are on these social media platforms for 9 hours a day.
Young girls, we know, are specifically susceptible to the impact of social media, and a lot of it relates to the culture of comparison. Their highlights, the best sides of themselves, and these perfectly curated images or comments, feeling lower in terms of their self-esteem, struggling with body image.
An internal study states 13.5% of teen girls say Instagram makes thoughts of suicide worse, and 17% of teen girls say it makes eating disorders worse.
For parents, I have heard the outrage and the shock.
Parents are concerned.
There has to be a moral compass here.
Facebook knows that parents today, because they didn't experience these things, they never experienced this addictive experience with a piece of technology, they give their children bad advice. They say things like, why don't you just stop using it?
Dr. Jenkins says it's important for parents to share an open dialogue with their kids.
Encouraging positive use of social media, adding, for example, like 4 really positive, influential female role models to your feed, so that you're starting to see these really positive people as opposed to some of the more negative influences.
Too much time on apps are known for causing problems with sleep, anxiety, and depression. Dr. Jenkins suggests limiting time to 2 hours a day on social media.